We all make choices about.
I'm going to Alex's party tonight and sleeping over.
Have fun. Hey, remind me about that party again?
And adults make choices whether to talk about it. That's true of parents and every other trusted adult in a kid's life. Kids want to know our expectations, and they want honest answers in everyday conversations. So talk with your kids and help lead them on a positive path. Because when you talk, they hear you.
Would you like to work closer to home, save money on gas, and be rewarded for your hard work and attendance? Then Bellisio Foods is looking for you. That's right, Bellisio Foods is now hiring for multiple positions and shifts with great employee benefits, an on-site health clinic, competitive wages, and advancement opportunities. Bellisio Foods is a company that truly values their employees. Apply online at BellisioFoods.com/careers.
Well, good morning, everyone, and welcome to the Thursday edition of the morning show right here on Main Street TV. Of course, Jennifer here to start off your morning with some of our good friends from the health department. Welcome.
Thank you for having us.
Yeah, thank you for being here because you guys are going to talk about something really, really cool coming up, or that you're doing, and it's just an amazing deal for people because it's something that maybe people don't have access to. So, yeah. So let's talk for a minute about yourselves. I know that's hard for people to do, but tell everyone who you are and a little bit about yourselves, if you would.
My name is Kim Hughes, and I am a local Jackson girl, have been here my entire life, and love the Southeastern Ohio hills and the folks here. And I am the nurse practitioner who works at the Jackson County Health Department in the new primary care clinic that we have established there.
So that gives you a little hint about what we're going to talk about today,
Correct.
right?
Sorry if I spoiled it.
No, not at all. I think that's fantastic.
And I'm Jenny Galusha. I am not native to Jackson.
If you're not an Evans or a Davis or a Galusha isn't really
No, it's not really from around here. No, I'm from Columbus. My
welcome,
husband and I
Jenny.
recently moved here about 2 years ago.
Okay.
And we love it.
Good.
I love the small town. We felt very welcomed here.
Good.
It's fantastic. I am a nurse with the Jackson County Health Department. I work with our primary care clinic. I'm the clinic supervisor. And I also am the public information officer for the health department as well.
Which is why you're going to put that Facebook post out in a little bit.
It sure is.
Hey,
I
that
run
was
all
something
of the
we
social.
we were talking about off the air. What name? Where did Galusha come from?
Somewhere overseas. We're not entirely sure.
Oh, really?
It's
The
a
heritage?
European
Okay.
mix of things.
It probably started out as one or two names and somehow meshed
it's
into
evolved.
that. Yes.
Yeah.
That's kind of interesting. That would be fun to like trace it back, wouldn't it?
Yes, it would.
Yeah, for sure. Very good. Well, welcome to the area. We're so glad to have you here.
Thank you.
So how fun. All right. So you all mentioned the Jackson County Health Department primary care clinic, and I'm going to be very honest with you. I didn't know that was a thing. So that's why you're here today.
That is exactly why we are here. Yes. It is a new thing that we've got going on.
Oh, it's newer then.
Yeah, it's
okay,
relatively
I don't feel
new.
so bad then.
Yep. And we're just now really starting to get advertising out there. And, I realize there's a lot of people we're not reaching that don't know we have this, and we need to come on here and talk about it.
Absolutely, because, with healthcare, we had a primary care physician from, Holzer here yesterday, and that's all well and good, but there's
it's nice
also
to have
a need.
options.
Yeah, it's absolutely nice to have options. And the health department's pretty easy to get to, right in the middle of town. So, all of that stuff. So how did the Jackson County Health Department primary care clinic come to be?
It came to be from a grant that we received from the Ohio Department of Health.
Great.
Yep. And it's a wonderful service. It started as we got a grant for sexually transmitted infections A lot of people know them as STDs.
Yes.
They're now STIs.
That's a thing
That
still.
that is still,
still
a huge
thing.
huge thing.
Yes.
And that's one of our primary goals is to help people get that testing done and get treated for it. And that's something that we can do at our primary care clinic. But we decided if we're just going to be testing people for STIs and HIV, we're not going to help a whole lot of the community. You know, we need to be able to do more. So we
Okay.
evolved that into our primary care clinic that people can come in. We're open 3 days a week. They can come in for testing. They can come in for annual checkups, urgent care visits, vaccine administrations, school and sports physicals is a big thing with our kids as we're getting into, the summer. They're going to need those next year for school.
Sure.
All of that. Annual checkups. We do screening for age-related diseases. Diabetes, high blood pressure, high cholesterol management, that sort of thing. We're kind of a little jack of all trades.
Good. Now, how do you two work together? What are you all? What's your involvement with the clinic?
Well, so as the nurse practitioner, I am responsible for seeing the patient, making the diagnosis and then treating that appropriately, ordering diagnostic testing if needed, performing the exam and then ordering those testing and any, prescriptions or any therapies that might be needed to, make an impact on that disease process or what's going on.
Okay, very good.
Mhm. And I'm the nurse that works right alongside Kim. So if
Okay.
you walk in,
You
I
guys
will
are
be-
working hand in hand.
Yes. Yep. It is myself and then Lori Schaffner, who is another nurse that works at the health department that primarily run this. So you will see either me or Lori and Kim, and we are your faces of the primary care clinic.
See, there you go. Now you know them, so you can feel more comfortable about going in and can put names and faces together.
Absolutely.
And
which-
they're so sweet. See? Very good. All right. So the hours of operation are Mondays, Tuesdays, and Thursdays. Mondays 9 to 5. So that gives you plenty of time. Then I like that Tuesday 10 to 6. So if anybody's, working 9 to 5 or whatever, they can get in there. And then Thursdays 11 to 7, which makes it easy as well if you're working different shifts or
Absolutely.
whatever.
Yeah.
So that's really smart that you guys staggered those hours.
Yeah.
Good
it's
job.
Making it access easier. That's the goal. So
Isn't it?
yes, it
Mhm.
is.
Yeah.
And it offers an alternative. There are multiple providers in our area who do a wonderful job.
Sure.
But we also, felt like that there was still folks who are not being reached, and have no access to health care. And so we wanted to expand those hours, make ourselves available, and offer really good care to, our folks in this county and the surrounding counties.
Yeah, absolutely. And hopefully we're moving kind of past the C word situation. I get so mad saying it, so I just call it the C word now. And so, but that has been such the focus for the past 3 years of our lives that, in my opinion, and I'm sure that you've seen it, people neglected themselves in other ways.
Yes.
Absolutely. And understandably so.
Sure,
COVID took over our lives for a while.
very much so.
Yeah. And we're kind of able to get back to our normal lives. And part of that is, getting yourself in to see a primary care provider. Make sure you're still good to go. Nothing changed within those last few years.
Absolutely.
An opportunity to catch up on your health care.
Yeah, right. If you
Yes.
haven't been keeping up with it, it's not too late to start now. So this is a perfect opportunity to start. What have you seen with, the C word and like people neglecting going to the physician? And I'll be honest with you, there was a day that I went up to the Holzer Clinic for something. Didn't think one thing about it. And I was there I wasn't sick. I had like a rash.
Mm-hmm.
Walked in, and this was like, I don't know, a few months ago. And I thought to myself, oh my gosh. And I mean, everyone in there was extremely sick and whatever. And I thought, oh my gosh. I had completely forgotten about, the fact that I called my husband. I'm like, I don't have a mask. And he was like, you're crazy. Like, what are you doing up there? But so people are still getting sick and whatever, not necessarily maybe with COVID, maybe it is, maybe it isn't. I don't know. But so that made me not want to go back to the doctor again.
Absolutely.
Because I started getting really paranoid again about, and if anybody's gone through.
And so it doesn't, it's still a very real thing.
Absolutely.
Yes.
Don't let your guard down.
That's right. That's right. And I think that those precautions that we've taken still are applicable in many instances.
Wash your hands.
Correct.
Yes, please.
That's correct. And if you
Like a lot.
Yes. If you struggle with things in your own health care, then you need to be extra careful, and place yourself at a distance. But I think that it's time that, we don't neglect anymore those chronic health care problems. So this, again, it's just another place to come to do that.
And you're right. And, as you said, understandably so. I understand why nobody wanted to go to the doctor for 2 years or whatever. Like
I did not want to. I didn't want to take my children out.
No.
We put ourselves in a bubble.
Yes. And so did everybody else.
Yes,
and that
they
was, well, hopefully you probably did. And that was smart. But you can't not have your mammograms and not have all of the screenings that you need. Your blood work once a year. We talked about that yesterday. All of those things. Don't care if you're 20 or 80, you need that done.
Absolutely.
Correct. So this is a perfect opportunity to do it. So let me back up for a minute, and maybe I'm getting off track a little bit, but do you all still have the immunizations and things like the COVID shots and all of that stuff? So
yes, we
the
sure
boosters and whatever. So if somebody comes in,
we can
you can
those.
totally take care of that as well.
Yes.
Absolutely. Yep. We can administer those. And
So 2 birds with 1 stone kind
Absolutely.
of situation.
absolutely.
Yes.
Yep.
Good
That would be
preventative
so
care.
smart. Yeah, that would be so good.
Yes.
Mhm.
Okay. And with the boosters, I don't know what they're recommending now. And maybe as a nurse practitioner, if you've had like your COVID shot per se, but then have had one booster, when do you get another one? Or, how does that work?
I am not familiar because I don't do the public health side.
Okay,
I do this
no, and that's
primary care
fine.
clinic. But, we do offer the bivalent COVID booster now.
Okay.
We do have the other boosters back there, but what we see is that most folks are going with the bivalent booster and
that's the one
getting
I've heard
that,
of.
and if you have questions, certainly you can call in and we can make recommendations based on the evidence and the guidelines
Okay.
for those boosters. But we also offer things like, if you need a Tdap, which is your tetanus, diphtheria, and pertussis, and most of us as adults do, especially if we're going to be exposed to itty bitty babies.
Yes.
So grandparents and babysitters or caregivers, we can offer any of those type of boosters. Or if there's an immunization, that you have not had, hepatitis A or something like that, and there's going to be reason for you to have that, come on in and we can certainly, give you those immunizations as well. Or we can piggyback that onto your primary health care visit.
Sure. Okay.
Yes.
That's really smart. So how do you know whether you've had that stuff or not? Because a lot of us are like, I don't know.
That is a great question. So there is an online form. It's called ImpactSys that we have access to as a health department. All of your doctor's offices and hospital systems within Ohio has access to all of this.
Really?
And they communicate with each other, so we can look you up when you come in. And we can.
So you'll know when Jen had her last tetanus shot or
yes,
whatever.
and that's something we can also print off for you, because I know sometimes when you graduate from high school and you're going into college, sometimes you need to have your vaccine record. Where in the world are you going to get that?
Right.
We can get that for you. We can get that information.
Oh, and how do you go about doing that? Just come in and ask? Or?
Yeah, just come in and ask.
Hey,
That's something we can do.
Now you've learned something new today. No,
Yes.
that's very, very helpful because as you said, if you're going to be around, maybe, you're going to be a new grandparent and you certainly don't want to put your new grandchild at risk or whatever. What, are there new vaccines that I need, to do to be around that baby?
Sure.
Because the last thing you would want to do is upset your, baby.
Yes.
But okay, so we digressed a little bit, but I think this all goes hand in hand. So I think
Yes,
it's very,
it does.
And all of this stuff can be done at the health department. I've had my tetanus done at the health department. That's the funnest shot ever.
Isn't it fantastic? How long was it before you could lift your arm?
Yeah.
It's really important, but
It is.
it's a doozy.
Don't need to do any heavy lifting for like the next 2 days, and then you'll be
Yes.
fine.
Yep, you'll be
Yeah,
good.
Yeah. So anyway, it's not excruciating. It's just annoying more than anything.
Yeah.
Yeah. And not the most fun shot in the world. Okay, so the Jackson County Health Department Primary Care Clinic, is it open right now? Are you guys up and running and ready to go?
Yes, we are.
Okay, very good. And I see there where it says walk-ins are welcome. Would you recommend an appointment, or is it just you would rather people just walk in?
We would recommend an appointment only because if, like I said earlier when we were on the radio, if you are a walk-in client and you come in at the same time as someone who has an appointment, we're going to see the person who has the appointment before you. So there might be a
Okay.
little bit of a wait.
I got you.
So if, something's going on and you don't mind to wait a little bit, walking in is absolutely perfectly fine. There's nothing wrong with that. But I would recommend if it's something like, hey, I need to get a physical or something that's going to take a little bit of time, if you have the ability to call in and schedule an appointment, that would be best.
Okay, very good. And that makes most sense. 286-5094 to schedule that appointment, extension 2837. So Dylan, I don't know if you could post that up there for us or not. 286-5094, extension 2837. And okay, so let's talk about the patients that you see. And you say that the talk about this kind of started with the ST, well, we called it D, but what does the I stand for?
It's an infection now rather than a disease.
Why?
Because it's an infection.
Okay.
Yeah.
That makes sense.
It is. It does. Yeah, that's old school, Jen. You just gotta.
Well, hopefully I never have to worry about that.
I hope so. But if you do, you now know where to come to get tested.
And you know what to call it.
Yes, yes.
Yes. So thank you, Dylan. We appreciate that very much for you putting that up there. So let's talk about that for a minute. What are the STIs that are prevalent? Is it more prevalent in our area, or is it more prevalent out and about in the world? People just aren't talking about it as much.
So Jackson County has a problem.
Okay.
We do. And
No, let's talk about
absolutely.
that. Like, let's spew it out.
yes.
Let's get to it.
I was going to say, sometimes folks don't like to talk about those things,
Hey,
but
let's talk about it.
yeah. So there are, we're not a big city. We're not.
Correct.
But for our area, we do have some problems with certain STIs.
Okay.
We have some problems with one called chlamydia, and it is easily detectable, easily treatable, but often does not have symptoms. And so the individual does not know that they have it, but they can easily pass it on to any of their partners. And so the goal is to, treat that individual who does have that problem as well as their partner. And so
Stop it in its tracks.
that's right.
Yep.
That's right. Or, and treat anyone who may have been exposed to that problem. There are also multiple other STIs that are, some of them are ones that people think that have gone away, syphilis, and
AIDS. People don't think AIDS exists anymore.
Yeah, it does.
Because
And
you
it
don't
does.
hear about it as
Yes,
much.
that's
Correct.
right.
And
Yes.
HIV testing is something that we can do at the health
Absolutely.
department as well.
Okay,
Yes.
perfect.
And we test for all of these.
Yes, we do.
And so, and the big thing is I think that people, first of all, it's one of those things that we don't want to talk about. We keep hush hush,
Hey, I say we talk about it. You know, it's
Yes,
like, let's
please.
get it out there.
That's right, because then people know that they can access healthcare. And the one thing is those tests and that testing and those services are done with the utmost confidentiality. So
You all aren't like walking through the health department like, that's the worst case of the chlamydia I've ever seen. Oh my God.
No, absolutely not.
No.
Did you know so-and-so has... no.
That is not happening.
Absolutely.
Right.
Number one, it's blatantly illegal.
Right,
And,
correct.
But no, you're just, as healthcare
Yes.
workers, that's not what you do.
No, it is not. And even when, you come in as a walk-in or you call to make an appointment, if it's not something that you're comfortable telling our front end girls, you don't have to tell them that.
That's
Just say, hey, I need to make an appointment. And you don't have to say anything outside of the room. We had
Okay.
an individual at one point who came in and they weren't comfortable telling me what was going on, but they were comfortable talking to Kim as the provider. And that's
Yes.
okay too. You do not have, we don't all need to know what's going on.
Right. Like, could you just
but
clear
you
the
do
room
need to
for a
get-
minute? And
Yeah.
It is.
And
Yes.
that's perfectly okay. Your comfortable level is where we will meet you at. The
We
really
just
important
want
thing is
to
to
see
get
you.
treated. And
Correct.
yeah.
Mhm.
And what is really nice is we will treat your partners as well. Your partners don't necessarily have to come into the clinic to get treated.
okay.
Yes.
Okay. Which, yeah, good luck getting everybody to come in.
Yeah.
So,
But we do the best we can. So
correct.
Yes.
Yeah.
Right.
Yes.
So, can we back up for a minute and meet and I mean, can we talk about some of these diseases and like what their symptoms are and like how, like, I guess you talked about chlamydia, I think you mentioned, and like there might not be symptoms.
There
And
may not.
what would make you think that you need to go get tested for it? Like, how is it transmitted? What does it do to you?
Mhm.
That situation.
So, so we'll start here at they are sexually transmitted. And
Okay.
that is a sexual encounter of any kind. Okay.
Yeah. Let's talk about, like
So
whatever.
that's right.
Mhm.
Yes. So, it does not matter who your partner is, your partner is male or female, anyone is capable of transmitting those diseases.
Okay.
We always think of the biggies. We think of HIV.
Yes.
We think of, gonorrhea and chlamydia.
Okay.
And then, there are some others that kind of are the ones that maybe people aren't aware of, but are still there.
Okay.
And that is syphilis, like I mentioned earlier. There's herpes virus. And so, yeah.
I have a preach about that, but anyway.
You go, girl. That's
So, herpes doesn't go away, right?
It does not.
No.
No. So don't get it. So I can just tell
Good
you
advice.
that I cannot. College is just a
It's a breeding ground.
breeding ground for
Mhm.
herpes.
It is.
And I swear to God, every young person I know that I can preach to, that I know is going to college, I'm like, listen to what I'm telling you.
Mhm.
Yes.
And I remember I
absolutely.
had this conversation with, I'm just going to say it, my niece. And at the end of the day, I said, okay, I have some advice. Aunt Jen has advice for you. And I said, don't do drugs. Don't get herpes. And she was like, what? She called me her sophomore year crying. And I said, what? And she said, like, 2 of my roommates have herpes. Oh my God. You were so right. And I'm like, I told you. It's a thing.
It is
Anyway.
a huge thing.
That
and
is
it's
Jen's
preventable.
preach. So many of my college, people, acquaintances, whatever, it happens.
It does.
It does.
And it doesn't go away.
That's right.
It does
Yeah.
not.
Okay.
Yes.
So yeah. The
Yeah.
other ones can be treated. So.
They can. They get
Courtney's like, what did I just walk into?
that one can be treated as well.
It can be treated.
Yes,
But
and kept under control.
Yeah.
But that virus exists in your body, for the rest of your life.
yeah. And it is
So,
not a good thing.
It is not. It is not. And nothing that exists inside, the body and kind of floats around in there is a good thing. So, but there are ways to prevent those exposures. And
yes.
but we said that, any encounter is, a risk as far as, especially if you don't know who your partner is and what their history is.
Yes.
So, most of them, if they are symptomatic, typically it's the female who is symptomatic.
Okay.
And that is just by nature of our
bodies,
parts.
how we're put
That's
together.
Right.
Yes.
That's right. That's
Yeah.
right. And typically what we see is that at the health department, someone has a risky exposure and they may or may not have a symptom or their partner calls and tells them hey, I've been diagnosed with this. And so they come into the health department and we take it, from there.
Okay.
So, the signs and symptoms of each and every one of them are variable.
What's the testing like?
Some of them are done by swabs.
Okay.
And then some of them are blood tests.
Okay.
That involve a blood draw.
So it just depends on what it makes.
What it
okay.
is,
All right.
correct.
But again, it's not a big deal. Just do
come
it.
in. And
Yeah.
we do have pamphlets and information
Okay.
readily available in our waiting room. If you just want to come in and wander around, it will let you know specifically HIV or syphilis or hepatitis C, how you can contract it, how to prevent it, what signs and symptoms to look for when they get tested.
Okay,
We have
very
all
good.
of that information available. We also have condoms and dental dams available for people.
Okay.
If you're getting ready to go off to college, stop in. We'll give you a goodie bag. And even if you're not going to use it, you're probably going to know somebody.
yeah,
who
give it
will.
to your friends. Yeah.
Yes. Yep. And
just
if
be
we
like, hey,
have,
what are you doing tonight? Here
right,
we go.
take this with you just in case. And I know having that safe sex talk with your child is really uncomfortable. It's not something that people really want to do,
Or
but
with
it's
your niece.
No,
Yeah.
see, but
Yes.
no, that I would rather everyone needs a cool Aunt Jen, right? So
absolutely. And if you don't
those
have
are
a
the
cool Aunt
talks-
Jen, you can
those
come
are
in
the-
and see us.
right. So those are the talks that you need somebody to talk to, right?
Yep.
So
Yep. And if you just
if
think
it's not the
that
parent,
it'd be easier to
come
have
talk to you
them.
guys.
Absolutely. Yep. If you're not on that comfortable level, which is perfectly fine, that's normal to not want to talk about sex with your kids. We'll talk to them.
Yeah.
With you in the room or without you in the room, whatever your comfort level is, we've got all those resources for people.
Totally fine. And I think that's wonderful. So again, this is how this whole clinic situations, started and came to be.
Yes.
But now you've added so much more to
Mhm.
it.
Yes.
So I didn't mean to get off on that tangent, but I wanted to just get it out there that these things exist and they're preventable, and you all are there for people, whether it be prevention or
Testing,
testing,
treatment.
treatment, all
Yep.
of
Yes.
that. Why would it be more prevalent in our area? Just
It's not. I don't think that it's more prevalent. I actually, you know what? It may be. Yeah. But I'm thinking, if you think of big inner city,
Sure.
kind of things, then you definitely are going to have higher numbers. But for our area, if you've got one case, that's just one too many.
absolutely.
So,
Yeah.
but I think that we have maybe some lack of knowledge
Yeah.
of it. That's usually one of the things about healthcare. If people just don't know, then we have that.
That's why I want to blurt it out here today,
Yes. Yes.
Why not?
Absolutely.
And then we
Yeah.
also, have some struggles with drug addiction
Yes.
in our county.
And they kind of go hand in hand,
They
right?
do.
Mhm.
Unfortunately, they do. And so, those are two subjects that are hot button and no one wants to speak of them. I'm with you. I would shout this
Yeah.
from the tallest hill in Jackson so that we could say it and get it out there. And then the goal is to help and impact
Yeah.
our community.
Make it not taboo to talk about.
That's right.
Absolutely.
Mhm.
yeah.
Because it
Yes.
shouldn't be. This is all regarding your health and keeping you healthy and alive, living longer.
Yes.
And for the best for our community.
Yeah.
I love Jackson,
Right. You
it's,
grew
it's
up
our
here.
town.
You
Yes.
moved here and love it.
Absolutely.
So we want what's best for all of you out there.
That's right.
Yes, we do.
That's right.
So, and it all exists. We're not making it up. Don't stick your head in the sand. Okay. All right. there's drugs out there too, folks.
Yeah.
Yes, there are.
We have a problem. Yes.
Yes, big one. Okay, so if we move on past that, and I didn't mean to focus on that so much, but I just wanted to talk about it. So
It needs talked about.
It
So I
does need talked
appreciate it.
about. Yeah. Okay,
Yeah.
good. All right. So what would be what are the main things that people are coming in to see you for besides the STI situation?
So, probably just about whatever they walk into any other clinic for. You know,
Okay,
and so
fair.
yeah,
That's a fair.
yeah. So if I wake up with a sore throat, you know, I go see a provider,
Right.
And so that's what we see. If I
Okay.
wake up, or if I know that it's time for my annual physical and I need labs, or I need to be seen every 3 months for my diabetes or hypertension or high cholesterol, you can walk in for that or make an appointment for that.
Great.
Yeah, we do.
Do you do the labs there, or
We
do
do.
you? Oh,
Yeah,
wow.
we'll draw them there.
Good for you.
They are drawn there, and they are sent to a company called LabCorp.
Yeah.
And fortunately, it's a relatively quick turnaround
Very
time.
fast.
So
Yes.
yeah, so it offers it's a nice service again
Yes.
that we can offer.
Yep. That's
Yes.
awesome. So, okay, so labs. So if you wake up sick in the morning, you know, when this goes back to the whole C word situation, you know, a lot of us woke up and we're like, oh no, I don't feel well. Is it, you know, you go straight to that. Well, there's a million
Right.
other things it could be besides
Absolutely.
that. You know, I can remember several years ago now, for the first time in my life, I got a bronchitis, and I was like, oh, God, I was so sick. And I was, I went to see a friend, and she was like, oh, it's bronchitis. I can actually, that's one of them that we can actually treat. Like, you know,
Yes.
antibiotics work for. You're in good shape. It's not a fun thing to have, but you need to go see somebody because you don't necessarily know that it's viral or whatever at the time.
Yeah, you don't want to make that assumption.
No.
Yeah.
Because I think so many people now have gone the other, like it used to be you woke up in the morning, you didn't feel well, you went to the doctor. And then it got to be, well, don't go to the doctor because they can't do anything for you anyway situation, because it's all viral or whatever. And that's not necessarily true either.
No, I'm going to say come into your doctor.
Yes.
Come in to see us. And
Please,
we do
please
have
err on that side.
Yeah, we can test you for COVID. We can test you for flu. We can test you for strep. You know, there's all those other things that it can be.
And what for me, peace of mind would just be to rule out.
All of those
Absolutely.
things.
Because you want, even if it is just, you know, a common cold, you want to know
Which
that.
we all still get.
Yes, we sure do.
Yeah.
You know, you want to know that before you go out and about. You know, if you go,
Correct.
you know, you've got a baby shower that I'm going to later this weekend, am I safe to still go?
Yes.
You know, you want to
Yes.
think about that.
Do I have a cold? If I have COVID, that's a whole other situation.
Absolutely.
Or the flu, or
That's right.
like you said, strep can be treated obviously with antibiotics too. Like that
Yes.
could be gone in a day or two. So, or you could start feeling better. So there's just a million different things it could be. Rule some of the stuff out, even if you never
Absolutely.
figure out what it really is.
Yeah, you can rule out those really big ticket
Yes.
things that you're like, oh, I have to stay inside and not talk to anybody for a while for.
Yeah.
Yeah.
Absolutely. So if you're not feeling well, this is a perfect opportunity, Monday, Tuesdays, and Thursdays. Now, you talked about work, school, sports, physicals. What all entail? What does that entail? Who needs those? Like, I mean, who?
Yeah.
So if you're a student athlete, you're going to need one.
Mhm.
If you're
Okay.
a student, you're going to need one. A lot of
Really?
workplaces now require upon hire that you have a physical before you get on their insurance, just so they're, you know, they kind of know this is where you're at. Okay. Insurance companies want to know. That's something that we can do.
Gotcha.
When you're going into college, they require you to have one. I know if you're going into the medical field, like you're going into becoming a nurse or a physician or whatever you're doing, they're going to want that. And there's certain vaccines you need to get before you start those programs.
Okay.
We can offer that for you.
You know, and the great thing about like going into college, and you know, I think some colleges require certain vaccines, some don't. You can pull up the, what did you say that was called again?
Impaxis.
Impaxis, and they can pull up and find out what vaccines you've had.
Yeah.
What
And
you
if-
need.
And if you've already had them, you can prove that you have,
Correct.
which is great. Too.
Yes, because sometimes if you can't prove that you've had this vaccine, you have to have titers drawn, which is another lab. People don't love to be poked if you don't have to be.
No.
So if we can prove that you
not this
had
girl.
it and not draw your blood, that's preferable for everybody.
Yeah, I'm one of those that if I look down, I'm
So we would lay you down then before we stick you.
perfectly fine if I look that away. I'm like, I'm good.
Yep, I just don't want
I
to
just
see my
don't
own
want to
blood.
see me bleeding to death into a, which you're not, but
Right. No, but I can see how that would be a
And
little
you're
uncomfortable.
wide.
You're like,
yeah.
oh my god,
my blood's in a tube.
Oozing out.
Yeah, I'm all
Wow.
there. There's a whole lot of blood in your body, but
Yes, there is. You would be surprised.
all right. So those are things. So work physicals, school physicals, all of this. You can come see these ladies. They will take fantastic care of you.
We will. And one thing I want to point out is that we will treat you and see you. You will not be turned away if you do not have health insurance or if you are not able
Really?
to pay. Yes. If you have health insurance, we're going to run it through your insurance company.
Okay.
If you don't have health insurance, we have a sliding scale fee that is based on the National Poverty Guidelines,
Okay.
and you will pay a percentage of whatever the cost is. And if you're not able to pay that, we will work with you to set up a payment plan. But you will never actually receive this will never go to collections for you.
Correct.
So our underserved population, people who don't have health insurance, because not all jobs will provide you health insurance that you can afford.
Well, that and or just in general. I mean, it's just
Yes.
not a thing anymore
Yeah.
because companies can't afford to do it.
Correct.
right.
It
Yeah.
is very expensive.
Yes,
so if
it
you're
is.
uninsured, we will still see you and treat you.
Absolutely.
Please come in.
They're begging you.
We
Come
really
see
are.
them.
Please come see us.
Look how sweet they are. Come see them.
I think we're
And we're good
fantastic.
at our jobs.
We are very good at our
Yes.
jobs. Yeah.
Absolutely. So I was looking down. So one of the things that are, so we had a nurse practitioner from Holzer on yesterday, and she's building up her practice and whatever. But one of the
Wonderful.
things I asked her, what are some of the things that you're seeing that's like kind of a newer deal? And she said, and I see this on your list, and this is why I'm bringing it up. She said they're seeing a lot of anxiety and depression issues. People, and I don't know whether it exists more or people are just feeling more comfortable talking about it now. Doesn't matter either
That's right.
way.
Mhm.
If it's an issue, please talk to somebody about it.
That's
and I
right.
see that you guys actually listed that there.
Correct.
And she said they're seeing it in a lot of younger folks as well.
Yes. A lot of our adolescents are high school age kids. It's very prevalent. And, we can even help parents know what to look for in your kid.
Yeah.
We can help you and educate you. Depression and anxiety is a really, really big deal. And
Yeah, it is.
a lot of people don't like to talk about it. It's uncomfortable.
Well, it goes
but-
back to it's the same as an STI or
It has
whatever.
that
It's
stigma
taboo.
attached to it.
And it's like you're weak or you suck or
Yeah. And you're not. You have a chemical imbalance that you have no control over.
Yeah.
Um,
Nobody chooses to wake up in the morning and be depressed.
Oh,
I
heavens,
don't
no.
think.
No, absolutely not.
No.
No,
or
but
be
if you're starting
anxious.
to feel sad or you're starting to wake up in the mornings and you're just struggling to get out of bed and you don't know why,
Yeah.
come talk to someone, whether it be us or your primary care provider, and let them know what's going on.
Yeah.
You don't always need medication.
Yes.
People don't
I'm so
love
glad
taking
you said
pills all the
that.
time.
Right.
Sometimes just having someone to talk to, whether, a counselor, can be a huge help. And we do not offer counseling services at our health department, but we will refer you out and make sure
See,
you get the care that you need.
And that's so good. I feel like people, especially with this, they have no idea where to turn, where to start.
Yeah,
And it's like,
it's
are there
scary.
resources out there? I don't know. And yeah, it is scary. And you feel helpless.
You do.
So
You do. And sometimes anxiety can present in different ways as well. You can have a
Yes.
panic attack and you think you're having a heart attack.
For sure. Or you're having a stroke or something.
Yeah.
Like literally.
Yes.
Yeah.
It has that same feeling on
Very
you.
much so.
Yeah.
Or you pass out.
Yeah.
I mean, it can really get to that.
yes, it can definitely
situations.
affect your body.
So yeah, kind of. I just want to mention that because it was something she brought up yesterday, and I saw it on your list, and
Yeah,
I thought,
yes.
okay, this is like a double whammy
Yeah.
of people
And I think
talking
that
about that.
the opportunity in this area, and I'm this, southeastern Ohio, for mental health counseling, it's available,
Yes,
but you struggle to find someone to take a patient because they're so busy.
yes,
So we can be your first step
yes,
in identifying and starting treatment, and then working on getting you into counseling, and hopefully we can find a provider that does mental health.
sure.
Yeah, we'll help
in
you
this area.
navigate that.
That's right.
Yeah, and that's good. And I like to say, your nurse and your nurse practitioner or your concierge, and I mentioned that yesterday. You get people
We
going
are.
in the right direction. If,
Correct.
you treat a lot of things, but then you can also
Mhm.
help them navigate to other things.
Yes.
as well.
Absolutely.
So I'd say what are some of the big things that you see in our area that people have? I'm sure blood pressure and all of that stuff. So
Yeah, I think that what's prevalent in probably actually worldwide and in our country is just exactly what we see. So yeah,
like we're not unique.
We are not.
We
No.
may have a little bit more of it, but we're not unique.
yeah. Oh no, we are unique. We are from Appalachia.
Well, that's true. That's a whole other story.
That's why I love us.
Yes.
That's
That's
the
why
truth.
we're so cool.
That's right.
Yeah.
That's right. That's why we are who we are.
Yeah.
So we are unique, and I love that.
Yeah.
The diabetes, hypertension, high cholesterol, obesity.
Yeah.
Yeah, those are the biggies. Those are the biggies nationwide. They are the biggies probably worldwide. And so, and there are a lot of things that go along with that kind of syndrome of those problems, and they cause a lot of healthcare problems.
Yes.
So, we do treat those, and we do, try hard to make an impact on lessening that disease burden, because it's a big one, financially as well as physically and emotionally for people.
It is. And, you get into, say, a diabetes situation, and then you get into, wound care situations, and then just so on. And
Yeah, it's
so
that snowball effect.
forth. Yes.
Yeah,
absolutely.
It affects the whole system. And so, our goal is to make that care so that hopefully the ravages of that disease don't impact that person in that
Right.
way, or we delay that as long as we can.
Yes.
Mm-hmm.
And so just come in and talk to these ladies. As you can tell, they're sweet as pie, and
Thank you.
and they know their stuff. And this is a perfect opportunity. And especially if you don't have insurance,
You still need health care, whether you have insurance or
Yes.
not. You still need to,
you are
take care of
worthy.
yourself.
Yeah.
Yes, you
You're
are.
absolutely worthy of health care.
You deserve to take care of yourself.
What your paycheck is, it doesn't matter.
No, it does
So-
not matter at all. If you don't have an income, that does not matter.
And if you're not doing it for yourself, do it for your kids and your grandkids and your friends and your moms and your dads. And
Absolutely.
That care
Do it
about
for
you.
everybody else that they don't want to lose you
Yeah.
before you're supposed to be gone.
Yeah.
Come and get preventative care. Stay safe.
absolutely. And that's a big thing. So I love this. Walk-ins are welcome, but you can certainly and are urged to make an appointment
Yep.
at the Jackson County Health Department Primary Care Clinic, 740-286-5094, extension 2837. Dylan put it up on the screen, and he so that you can see that as well. So very, very good stuff, ladies. Is there anything else that you wanted us to, kind of mention while you're here?
Well, something that I will briefly mention is
Yeah.
we have this in the works. There is not a lot of information going on about this yet. It is to come, so keep an eye out on our Facebook page. We, as a health department, are collaborating with Holzer Health System. And in April, we are going to be putting on a health education day. There will be
Love
3
it.
Saturdays in April. One will be held in Oak Hill. One will be held in Jackson. One will be held in Wellston. We will be talking about the importance of primary care with our clinic. We'll be talking about safe sex. We'll be talking about smoking cessation, naloxone. There are some providers coming from Holzer as well to talk about, like your OBGYN and your pediatrics and that sort of thing. This is going to be a wonderful event. It will be free to the community. We
That
will
is
provide lunch,
Ooh,
lots
free
of
food.
resources. Yes, Holzer, and we are collaborating on this. Information is on its way, and this is a very exciting thing for us. So,
Love that.
yeah, let's get that out there.
And since somebody over there is the social media girl,
That's me.
She'll be letting you know about that, as well as there will be a post posted today about tomorrow's Hug Your Heart event.
Yes, it is February. It's Heart Month.
It is. And
Yes.
you need to hug your heart, which means tomorrow at Parks Edge Event Center, there will be Hug Your Heart Day, and there will be a lot of free screenings. Oh, there, see, they dance. They have free lunch.
Go
They
them.
have, look at them.
It is
They
a
have-
wonderful event.
It's a wonderful event. There's, again, free screenings. There's food. There's fellowship. There's dancing. There's, a million different things that people
Awesome.
can do. I know they're going to have like bone density, cholesterol, like all kind of
Absolutely.
different screenings for you.
Mhm.
And it's all free.
yes,
right.
And
it
it's
is.
just a fun day.
That's right.
Yes.
So come on out to Parks Edge tomorrow. It's 11 to 1, I believe. 11 to 2. I lied.
Even better.
11 to 2 in the family room there at Parks Edge. So,
Yeah, take advantage of those services.
and
Wonderful.
again, right, absolutely. Like, if you go, let's just be honest, you go to a doctor and you have insurance or whatever, you're going to pay for that stuff.
That's
So,
right.
Yeah.
Go get it
Go
for
get
free.
it for free.
That's right.
Absolutely. And then if
Yes.
something comes back a little wonky and you're worried about it, come see Kim
come
and
see
I.
them.
We are
And
here.
That's exactly right. And you go and you see these girls, Kim and Jenny, and they will take great care of you.
We sure will.
So, yeah.
Yes.
Thank you so
girls
much for
are
having us
so
on.
That's right.
awesome.
Well,
And
thank
I'm
you.
so
Delighted.
thankful, number one, that you stopped by, but for what you're doing as well.
Thank you.
Thank you.
Yeah.
Yes, it is a privilege.
It is.
It is a privilege.
That's so sweet.
It is true.
Yeah, I know it is. And if you just need vaccinations, come to the health department as well. Say, I think I need some vaccinations. I don't know.
Yeah.
I don't know.
That's literally
You
all
want-
you have to say, and we'll take it from there and
Yeah.
we'll get you figured out.
Because you know what? It's so funny. Like the health department came on the program and did a tetanus shot for me and a flu shot one year. And I
That's
was
awesome.
like, okay,
Yeah.
cool. Yeah. And it was good exposure, whatever. And then they did the flu shot a couple times. And then all of a sudden I met my doctor, my primary doctor one day, and she was like, do you need a tetanus shot? I'm like, no, I just had a tetanus shot. Like, yep, I need a tetanus shot. Like it, 10
that
years
way.
sneaks up on
It
you
does.
just
It goes
like
very
that.
quickly.
And you're like, I started doing the math. I'm like, oh God, yes, it has been 10 years.
Mhm.
Yeah, and I want to
So-
encourage you. Our public health nurses, they do a wonderful job.
Yes,
Yes,
they
They
do.
do.
Shout
They
out
do
to
a-
them. They're fantastic.
They
Yeah, they'll be
are.
happy to stick you with whatever.
Oh, they sure will with a smile on their face.
Protect you.
Yes.
They'll be happy to protect
Yes,
you.
no, I'm just
Yeah.
teasing about that. No, they are there to protect. Yes,
That's right.
Yes, we also do TB testing. I know that's not something we really touched on, but just quickly,
Mhm.
tuberculosis
Yes.
is still a thing.
Is that like is that the one where they do the little
The
thing
little
on your
bubble.
arm?
Yeah, it's just a
Little
little bubble
bubble.
on your arm. You come back in a couple of days, we read it, and but we do that testing, and that's
Okay.
something that a lot of college age kids need as well. If you're
Okay.
going to be in the dorms and all that, something we do.
Yes.
We have a lot of things to offer. If you're not sure and you think I need to get something, give us a call.
Yes.
Yep.
Absolutely.
And please get your this is just my preach. Please get your COVID, vaccines and stuff because
do. Keep
just-
everybody and yourself safe.
Yeah, it is. And again, it's not necessarily about you as much as it is others. And if you don't know whether you need it or not, just call and check in if you're due for a booster or whatever.
That's right.
Absolutely.
So, cool.
Yes.
All right, thanks ladies.
Thank you so much.
Yes,
Very
it was,
good.
It was fun.
This
Thank
is
you.
a blast.
Yes, it
Yes.
was.
Yeah, come back anytime.
Okay, wonderful.
Thanks.
We'll talk STIs all day long. No,
Yes,
I'm
we
just
will.
kidding.
There are a bunch. I bet we could.
We can really inform you about
Yes,
stuff.
Yes, we can.
All right. Dylan, do you have the weather forecast brought up for me, buddy? because today, look at that.
I know.
We'll take it. Thanks, ladies. Yeah, so today is looking absolutely fantastic, depending on what weather forecast. I know the WSAZ news forecast had mentioned 72 degrees today. Thanks, ladies. Have a great day. So just depending on where you're at in our viewing area, you're talking about close to like 70 degrees today. Now, they are saying, here's what I need to tell everybody. That wind is going to pick up. They're saying about 40 mile per hour winds this afternoon. So if you can kind of avoid, being outside or hunker down, or it's not a huge deal, but just like maybe if you have lawn chairs out or whatever, secure those and
wear
that kind of
some
situation.
heavy shoes.
Wear some shoes. Yeah, suck you down to the ground.
Yeah, right.
And then a little chance of rain this afternoon. But then it's going to be, as the week rolls on, a little bit cooler. But I mean, it's saying like low 50s
It
this
felt
weekend.
when I came to work today, I was like, it feels like spring
It
out.
feels like spring.
It does kind of lighten your mood a little bit.
It does.
Yeah.
Yeah, Jamie and I were talking about that the other day because he was like, do you know, like there's a light at the end of the tunnel? And I'm like,
Right.
he's like, we get to March and you
Yeah.
can have those 75.
Well, and I left work
days
the
and-
other day at like 6 o'clock or whatever, and it was the sun was out, and I was like, oh, this is so nice. Doesn't seem like midnight when I'm
it's
leaving.
not dark at 4:30.
Right. Yeah.
There is hope.
Yep. That's right.
So how have you been, Courtney?
I've been good.
Yeah.
It was nice to hear all this. I did not know they did that much.
See,
over
I didn't.
there.
I didn't either, and I was so happy that they came in today to talk about that
Yeah,
because
I got sick over the holidays.
you did.
I did.
She had the sickness in her house.
I did. The plague was upon us. But I didn't know
She's the
that
only
was an
person in the
option.
world I know that sends an invite for a party. She's like, I'm having a party. And then
Yeah.
like 12 hours later, she's like,
No, I'm
hey, scratch
not.
that invite to the party.
Right. Never mind.
She's like, the plague has entered my home.
Yep. It got us finally. We've gone this long, but the C word finally got me and my husband. It was totally what you said, letting your guard down, not really
We're
thinking much
all-
about it,
You
not
just
staying
forget.
up on the hand sanitizer and stuff, and
Yep.
it got us. So, but I didn't know that was
It's
an
gonna
issue,
get you
and I was
eventually.
trying to find some place where I could go and get an official test because apparently I'm not good at testing myself because all of mine came back negative and
She was still had the
still
the
had the
sickness.
C. Yeah. So it was like, oh, I guess I'm not good at those tests. So
Maybe
but that
you're
would have been a
not
great option.
brave
so I'm
enough to
glad
stick
now.
that thing up
No,
your
I
nose
think that
enough.
was the problem. I think I was sticking it too far.
Oh.
Because where I went, when they did the swab, barely, just at the edge of my nose is all
Okay.
she did. So I must have been skipping
you were up
over
there
it.
around your eyeball somewhere.
Yeah.
Evidently, your eyeball didn't have COVID.
Eyeball in my brain did not have COVID, but the very lower part of my nose did. So, yeah, but that's a good option. That's great to know. I'll have to keep that in mind.
It is
'Cause there's
absolutely.
you have those things sometimes you don't want to go to one of your bigger, ERs or urgent care. You don't want to go. You just want to find out what you've got. You don't want to have to sit, like you had said, in a huge waiting room or whatever.
See, and that's a big deal. I mean, like, and so this happened to me too. I probably shouldn't say it, but
But she's gonna.
I'm gonna because I
We
was
need-
so freaked out. I went home and Jamie was like, "What's wrong with you?" I'm like, "I'm completely freaked out."
Mhm.
And I'm not knocking anyone. People are friendly in our area, and that's a great thing. But I was sitting in a waiting room one day, and somebody comes in, and they're super duper duper sick. I mean, like, had mask on, which is, whatever. But the coffee and the water, and sits right beside me and wants to have a conversation.
Yeah, spread out
And
a little
it
bit.
was an entire empty waiting room.
Yeah.
And I'm like,
I tell you what, that's one friendly,
do I
personable
do?
person though, because I in general don't like to talk people, period, especially if I'm sick. I will sit in the
Don't-
deepest, darkest corner. Do
Right.
not talk to me.
And
My
it's-
husband knows, like, Do not ask me if I need anything. I will let you know
She doesn't
when
even
I
like to
need
talk
something.
in the
Like,
mornings,
yeah.
let alone if she's
Don't
sick.
talk to me in here before 9 a.m. So,
If you walk in and say hi to Courtney and it's 8:45, you're gonna get a grunt.
Yeah. Yeah.
No, but think about that too.
when you
Like,
go in,
I know
yeah.
we're all friendly and we want to, you want to say hi and whatever. But what did you do?
I bumped the table and
Oh,
I thought
okay.
I was gonna fall.
He looked
Oh,
like he
that
had
would've
just
been-
like shot somebody. Like,
knocks the whole table
Um,
over. Whoops.
but yeah, think about that. Like, there's a giant waiting room out there. We could talk across the waiting room.
Right.
That's fine.
Yep. Yep.
But so yeah, that's a whole other story. But so yeah, I could see where this would be very handy. You can still make
Right.
appointments.
Yeah, I
Or you
would.
can walk in.
to definitely keep that in the back pocket for next time you need something.
Very good. Jackson County Health Department Primary Care Clinic,
Which I did go there and get a
Monday, Tuesday, Thursday.
I got there went there and got one COVID booster.
Yeah.
Very nice.
Yeah,
Nice.
and as they said, their immunization nurses are wonderful.
Yep.
And they have a staff for that too.
Yeah, very
So-
friendly.
And again, like whatever you need, and they have that computer. I didn't know that was a computerized thing. Did you know that?
I did not, and I should have asked when they were here, but where I was in West Virginia some of the time, well, for like all of my
Oh.
schooling, like I graduated from high school in West Virginia, so I wonder if it's a nation thing or if it's a by state thing.
Or does Yeah, I mean, even if West Virginia has that, could you
Or if I-
contact a
when
health
I
department
came here,
there
yeah.
and then
And when I came here, if
Have
my
those records.
doctor, when they updated stuff, did they submit it then?
that's a fair question.
Yeah.
Or
But
even
that's
if you
good to
say,
know.
I have my West Virginia records and I have my Ohio records. Here they
Well,
are.
It's good to know too for parents that might not be very organized with their children's records to know I can call this place if my son ever needs it. I mean, if that parent
If
ever
that
needs
parent
it. So that's
Asking
good to
for
know.
a friend.
just thinking of other parents, not anyone
may or may not be
at this
organized.
desk. So that's good to know.
That's so funny, but no, love that. See, and these are so many great things that we have in our community that we hope that you take advantage of.
Take
And
advantage
that's-
of and support. So if there's
Yeah,
a way
and
to support it.
I think
do it.
Jeremiah just pointed, the health department does have a levy coming up, and you think
Yep.
about all of the wonderful services that they do offer. So think about that I'm not telling you what to do. I'm just saying, think about
Think
that
about all the extras that they do that
when you go to vote.
Right. Yep.
Do you appreciate the fact that they're there doing all of this stuff? So
Right.
think about that when you're voting. Keep that rattling around the back of your mind.
for sure.
So very good. So is there anything you wanted to talk about today, Courtney?
I don't think so.
How's everything up front?
It's good. It's good.
Yeah.
I don't know if you told everybody that we have Miss Caitlin back. So
We did. She actually stopped by the show the other day.
Good,
Our little
good.
Katie's back. I
Yeah.
did shed a tear or two because I'm so happy to see her.
Yeah,
'Cause she's one of our faves.
Caitlin, we know you like being a mom, but why don't you come back here for a little bit? And she said sure. So
Yeah.
I'm excited about that.
I think that's a
Staying
win-win
busy.
situation for everyone. It's like what she was saying, here is she can work from home a couple days a week, still be there with the babes,
Yeah.
but still get out and be here a few days a week out in the land of the living with adults.
Right, right.
So it's the best
It's
of,
the
of
best
all
of both worlds, hopefully. So that's great. But nope, just staying busy.
Yep. Lots of great
Lots
things,
of things
going
happening
on.
around here. So
Oh man,
always
yeah.
keeps us busy.
Yeah, stay tuned for. There's going to be a lot of announcements and fun
Yeah.
things going on here and expansions.
Cycle search
and
is coming back.
yes. So
Yeah.
I think James and I have something up our sleeve for the cycle search situation.
Good,
So
good.
we'll see
Yep.
about the announcement. So
Yep.
yeah, it'll
Start
be fun.
hearing more about that soon.
Yay!
So, and too bad it's not already out there hidden somewhere because today would have been a great
It'll be
day.
a great day to go looking for it. You're right.
Speaking of those winds, though, if you do happen to have any type of outages with your radio or on the dial, it could possibly be because of the winds, because that does sometimes affect the antennas out there. So if you have
It
any
does.
issues on the dial, just hop on over to the app and you won't miss anything.
That's exactly right. You can always tune into that Total Media radio app and listen wherever you are in the
Wherever
world.
wherever you are in the world.
No matter where you are in the world, you
Mhm.
can listen, even if the actual radio station is down. And winds can make powers go out. Power
Yep.
goes out in at the tower.
It's out. We just gotta wait till it comes back on.
Nothing
so.
we can do about that. So.
No, but
Yep. Lots of great things going on here. Lots of fun. And we'll be keeping you updated on some things that we have coming up. So thanks, Courtney, for stopping by. I just wanted to catch up with you.
I know. It's been a
Yeah.
while.
I know.
Somebody took a 2-week vacation.
I know. Well, it was a 1-week vacation and then another
Work week. Out of
somewhere
work
else.
week
Yes.
somewhere. Yeah.
So
That's fun though. Fun stuff.
it is.
Yeah.
I got to hang out in Cleveland and see a Christmas Story house. So
I mean,
there you go.
we need to get there. I've never been there, but
It was cute. It was
yeah,
fun.
we need to go.
All right. Well, we better get out of here for the day. Going to meet our contractor about the new place here.
So exciting.
Yeah.
I still think we need to go roller skating in there. Can we do that, or is it too bumpy?
It's too bumpy right now, but it won't be at some point, and we can roller skate till the cows come home in there.
Right?
I love it. And there's a ramp.
Oh,
We can go real fast.
I got my helmet and my pads, so let's go.
Y'all just wait. It's going to be a hoot.
Well,
As we
that's
all come in
exciting.
with something broken. So.
Yeah.
Yep. All right. So have a great day, everyone. Thank you so much for tuning in. And our good friend Pete Wilson will be here in the studio tomorrow with news. So we'll talk about some great things there. So there you go. Have a great day. Thanks for watching. And thanks to our friends from the health department.
For sure.
And we'll see you tomorrow. Bye,
Bye, everyone.
everybody.
This just in.
The Telegram News has a new website.
TheTelegramNews.com.
Same dedicated coverage.
Same trustworthy news with a brand new look.
Covering Jackson and Benton counties and surrounding areas.
Locally owned and operated, TheTelegramNews.com has its finger on the pulse of the community.
Stay up to date on local events, high school sports, and breaking news.
TheTelegramNews.com.
Subscribe today at TheTelegramNews.com.
Check it out.